Our hand center is involved in treating clinical patients as well as research, both basic science and also clinical research for advancing sort of treatment and care of pediatric hand patients.
So let's do this.
Our clinical practice is a variety of children that are either born with sort of what we call congenital hand differences or upper extremity differences, or patients that have had trauma or something happened to them after they were born. There's a lot of patients that come through here that get no surgery at all because all they really need is a lot of encouragement and the ability to grow and to expand their horizons.
And at Scottish Rite, they also help kids like me emotionally too. Like, you can't give me my hand back. I'll be missing a hand for the rest of my life. But nothing's wrong with me, I'm just different.
All right, here you go.
Allie's one of our patients that has a diagnosis called arthrogryposis or amyoplasia. And so with us, they undergo a series of surgeries from the time they're, infants, meaning 1 to 1.5, to when they're teenagers.
Okay,
I have a condition called arthrogryposis multiplex congestia,
which is mainly contractures in his joints, his hands and his wrists, like they were kind of tucked down and out, behind his back where he couldn't really do anything. We started coming here when he was about 2 weeks old, I think, was our first appointment here. He's taken muscles out of his legs, put them in his biceps. He's gone from not doing anything at all, couldn't even hold his own sippy cup when he was 2 years old, to where he does everything on his own.
Scott was born with thumbs that were very hypoplastic, meaning that he couldn't use them for anything in terms of function. And so we moved his index fingers over to be thumbs. So these really used to start off as his index fingers when he was born. And over time, they begin to think of it as their thumbs, and it functions as a thumb. It gives them good opposition and function.
Dr. Oishi and his team were extraordinary what they were able to accomplish, and everything went off without a hitch. I mean, not only is he able to function, normally, he's extremely talented with his hands and has won prizes and awards in school for art and for handwriting, and he's self-taught on the keyboards to play, music. He can type faster than I can. It's just amazing.
So the Hand Center of Excellence here at Scottish Rite specializes in treating all sorts of children with congenital anomalies, whether it be web fingers or reconstruction of patients or children with extra digits, or changing the position of digits to give the kids more function. I think one of the real benefits of being a patient here at Scottish Rite is that in our clinic, if we feel you need to have therapy, we have a therapist that's literally steps away from us.
Ready? Bring that arm in, bring it in all the way, all the way, all the way, touch your nose.
My colleague, Dr. Chris Stutz, and I are able to see many patients from the time they're a few days of age up until the time they're 18 years of age. We're able to keep a big database of our patients as far as what type of diagnosis they have, what type of surgeries they underwent, and what their outcomes were based on very good outcome measures.
Can I see you?
Yeah.
So Mason was born on a Thursday, and he was unable to move his left hand. And no one was able to identify what was wrong with him. So in the first 7 days of his life, we ended up visiting 6 doctors, a lot of specialists, and then we got referred to Scottish Rite Hospital for Children. And as soon as we walked in, they were able to tell us and identify the issue.
So this is called a free functional gracilis transfer. You can see that when he does that, that's his muscle that we transplant actually from his leg.
Recently been tested, he has roughly 40 to 45% usage of his left hand already at the age of 7. We can tell that he's growing and getting more use all the time. Scottish Rite, with the usage of Hand Camp, has given him the confidence to be able to talk about his arm. He's not embarrassed of his arm. He doesn't hide his arm from his friends.
We started Hand Camp back in 1995 to try and get these families together. A child with a hand difference can go to school, be involved in activities, and never come in contact with another kid with a hand difference. Coming to Hand Camp, realizing that they've got other kids that are going through the exact same things that they are, and being able to go back to their school and have that confidence that they gained at camp is invaluable. It's also a time to really hit the parents with a lot of support as well and give them ideas and information about how to handle teachers and athletics and schools, and just encourage their kids to be involved in activities. These counselors let the parents and the kids know that, you know what, everything's going to be okay.
Scottish Rite was a godsend. every volunteer, every employee, every doctor, every nurse that we came in contact with has, not only are they at the top of their field professionally and with talent, but the passion that people seem to put into their jobs here was inspiring.
One of the most important things that we do here as clinicians or as educators in the hand team is that we train fellows and trainees that then go out and practice pediatric hand surgery. Our center's message is really one that Peter Carter, who was one of our retired hand surgeons here, sort of taught us all, which is sort of the 2-4 rule.
Either do something to them or you can do something for them. So we practice that rule every single day.
The first thing I would tell a new parent of a child with a hand difference is it is going to be okay. It doesn't seem like it's going to be okay now, but your child will figure out how to do everything they ever wanted to do. They will be stronger because they have the difference and they're tougher. They can handle more things, and life will be absolutely wonderful with that child.
Scottish Rite, to my family, they're almost like extended family.
We knew that we had the best doctors. They'd done it before. We knew exactly what they were going to do. Everything happened exactly the way they said it was going to happen. And it all went off without a hitch. The results speak for themselves. I mean, yeah, we love Scottish Rite.